Outside the ER at Community Regional Medical Center, paramedics are bringing in a patient in need of immediate care. David, already paralyzed from a terrible automobile accident, is back in the hospital with an unknown illness.
The reason he's in the ER today is because for the last 3 days he's been getting progressively weaker, and he has a fever. He does have a catheter that is in his bladder. That is a retained catheter. It's probably been in for a couple of weeks, and chances are it's very likely that that is the source of the infection. So we're going to remove that today and replace it, and then we'll get a clean urine sample and send that to lab to see if there's an infection there. What we're going to do right now is change that catheter that he has in his bladder. We'll put a clean one in, and then we'll take a urine sample and send that to lab to see if that's a source of an infection. So these catheters are put in, and they have a balloon, and that's filled with sterile water, and that's what holds the catheter in place. Oh, okay, good. Thank you. And so I'm just going to remove the water now. Okay, so here's, looks like six cc's. All right, so that balloon now is deflated. How are you doing?
Okay.
All right, no change, huh? So there it is. It doesn't go in very far, does it? And the balloon was inflated right there. So we'll just take this away. I'm going to remove this dressing from your abdomen. Clean your, ouch. Are you having pain here at all, or is that's just the spasms?
She did that this morning too.
She just put that on this morning? Well, it needs to be changed.
It's imperative that the area around the catheter remains extremely clean.
So this is a sterile procedure. The bladder is a sterile area, so we need to make sure that we clean the skin as much as possible before inserting the catheter. It's always difficult to get all the bacteria off the skin, but we do it the best job we can. Get some lubricant on the catheter tip, and then we'll just insert it right into his bladder. So there it is. It's in the bladder, and now we will inflate that balloon.
All set.
All set. Okay. That's good. Okay, good. So now the catheter is in. So we're going to hook it up now to this tubing, take this one off. Good.
New sterile tubing is connected so Mary can get a urine sample.
Get it? Get it on good and tight. All right. Do you have any sensation here at all? None. Okay. So we've got urine in the tube now. So it's coming down. So I'll take a sample of this in just a little bit for lab. We have found out that he does have a urinary tract infection, and we're going to treat that with oral Levaquin, and he's going home. He'll be following up with his own primary physician in a couple of days.